distress, but we see a lot of incidences happening right now. We'd like to hear from you. What do you think is the solution and the way forward? At Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. With me in studio is Ken Munywa, a psychologist. Thank you so much for making time, Ken. And we also have Honorable Sylvia Kasanga, nominated senator. She's joining us online. She has a bill on this. She'll be giving us an update of how far that bill is. And retired Major Wairimu Mukuria, who's been in the service for several years, will tell us what the men and the women in uniform go through. She's a psychologist now. She'll be joining us in just a bit. But Ken, let me start with you. Are we seeing an increase in mental disorder or distress, so to speak?
Thank you, Trevor, for having me in studio. And it's actually true. We are having an increase. Our people are going through quite a lot. Remember, we just started forming hope that things will be better. And all of a sudden, we are back to square one because of this pandemic. And so there is accelerated depression amongst our people. There is also loss in hope. Hopelessness has really taken over. So many of us do not know what to do. Jobs are being lost right, left, and center. We have children now in the houses. We didn't know what to do with them. All of a sudden, we don't know whether they will be reopening schools or we are going through the cycle again. And so what people were going through last year was times of uncertainty. This time round, people are going through times of hopelessness.
Can we relate the economic pressure directly to the increase in depression?
There is a correlation.
Yeah.
It might not generally be Siamese, but there is. Fact is, if you lose your livelihood or your source of income, you're going to lose how you wanted your life to be. Everybody had anticipation. My 2021, I would want it to be this way. And now the economy is not doing that well. And if the economy of the country is not doing well, generally, it simply means even for me as an individual, I'm not doing that well economically. And my sources of income, my sources of livelihood, how I interact with people. We've just come from an Easter weekend where most of us have been groomed to spend it with our family members because of the lockdown and containment measure. So you can see that the pressure that we have been given externally and internally is too high, and some of us cannot be able to contain it. Our emotional containers are not the same. There are people who are able to hold the pressure for a while, and if it gets to the brink now and you cannot be able to contain it, then the people who are next to you first will be the first to suffer, and then generally the entire people around you and even in the country will suffer. When you report cases of depression, of murder, of suicide,
yeah,
of domestic violence, those cases will go higher than they were last year. Yeah. Unfortunately, the country will, at the end of the day, suffer.
Yeah. Sylvia, let me bring you back into this. You have a bill on this issue, mental health. What is the status of it right now?
Yeah, Trevor, thank you so much for having me here today. And as always, I'd like to appreciate the media houses for making this conversation because anything mental health must be discussed today. And it's important that Kenyans understand, really what is mental health. And it's good always, Trevor, just to start by making our viewers and listeners understand that, mental health is the well-being of an individual, in which an individual may realize his or her own potentials or abilities and can cope with the normal stresses of life, can work productively and fruitfully, and be able to contribute to his or her community. And you see that broadness of that definition makes you understand that mental health is a thing for everybody, and we all must understand and we all must work together towards it. The Mental Health Amendment Bill, Senate Bill 2018, had actually passed Senate. The last time I was here and spoke about it, had passed Senate and had gone to National Assembly. But unfortunately, it fell into the group of bills that were determined as money bills in National Assembly. And through a petition to the court, Senate had to go to court to get an interpretation of what is a money bill. And when that interpretation came back, all these bills that had been determined as money bills and not as bills to do with the counties were determined to be bills that should pass, and therefore they were brought back to Senate to start a fresh process, which is very painful, I must say, because the work we have done is a work collectively of 3 years, But it is what it is. It's now in the Senate. We have just gone through public participation. It's now going to be brought back to the House for second reading, and then third reading, and then it will go again to the National Assembly, where the Committee of Health and Sabina Chege pick it up again and finalize with it. Of course, it is our hope that this bill will see the light of day in this year, because the burden of mental health has now felt very severely. Of course, there is a correlation with the increase and with COVID and the COVID situation that has come upon the whole globe. The escalation of mental health issues is a global issue now. So you have to, say and equate it. The fact that the fact that the COVID situation has increased the mental health issues that have been underlying for a long time, and therefore we have a lot of work to do as Kenyans. And the legislation is just one part of what can be done. And there's a lot more, Trevor, that if we can discuss what more can be done. And I would like, if time allows us, to explain what the government has done, because I'm privy to what the government has done so far and what they're trying to do. I am privy to of course, the mental health task force that was formed by the president, and their report that was launched early last year. If you remember, when we were doing the work of the ad hoc committee on COVID, we had pushed for this report to be publicized, and it was. And we are very happy with the recommendations of the report, and now it's a question of having it roll out. And I can assure you, and I want to assure the citizens, that at least the ministry is feeling the pressure on the change that needs to come on the mental health realm in this country. Trevor.
So first, Kasanga, when you say it was categorized as a money bill, what does that even mean to begin with?
Trevor, the National Assembly and the Senate have had this tussle over bills, where the National Assembly will say that the Senate should not deal with any bill that has to do with money. And the argument has always been that Senate must do only work that relates to the counties directly, because we oversight the counties. And our argument is always that the counties have to do with Kenyans, and you cannot remove money aspects, from issues to do with Kenyans. And therefore, I'll give just a demonstration. You find that in a bill that is creating, say, an authority or an oversight authority that will require significant funding from government will be categorized as a money bill. So most of the time, what Senate now has to do is to remove certain aspects that require big funding, and then those aspects can be reintroduced in the National Assembly because they deal with direct money issues. So that tussle and that interpretation has been a big challenge for many of the bills that, of course, Senate had passed, and of course, bills to do with the counties. So the mental health one was caught in that, and they picked a few clauses. For instance, when our recommendation at level 5s, all level 5 hospitals must expand their capacity to host mental health consultancy, and Kenyans can, the integration of mental health to the healthcare system at, say, level 4 and level 5 hospitals, which are largely national government dockets. Then because they're national government, they say that that aspect will require more funding for those institutions, and therefore is a money bill. So those are the tussles that we were having. So the interpretation by the courts came as a big win.
Yeah.
Sorry.
So you are locked in a superiority contest while Kenyans are suffering.
It's an unfortunate situation, Trevor, but that is the state of affairs that has been. And now all those bills have to come back again to Senate and go through the same process as they did. And the good thing is that at least Senate leadership has agreed that the bills that had been thrashed out, we don't need to take too much time on them, so that they can then go to the National Assembly and hope that in the next 1 year or the remaining time that we have in Parliament, we may be able to pass them, because they're all very critical bills.
Okay. I'll come back to you in just a bit to tell us what the highlights of the bill is. But Ken, when you hear that sort of conversation, what comes to your mind? Because now we seem to be locked between contests between which house does what, and yet people are suffering.
It's an unfortunate situation. I sit at the National Executive Committee of the Kenya Psychologists Association. Yeah. And when the senator came up with the bill, we were very happy, very excited, because at the end of the day, we knew we belong to a profession that is here to assist our people to go through this. And 1 year later, in the pandemic, let's forget that it started in 2018. 1 year later, in the pandemic, we have not yet sorted this issue. And Trevor, all these challenges that we are facing here with our people, going through the pressures, the people who are here to assist would be the psychologists and the mental health practitioners. Yeah. And so when I hear the senator talking about it, and in 2018 we had a chat with the senator in a forum where we were in, and Major Mukuria, I know she might want to mention because she did a presentation on the same. Yeah. We were really excited because we said this is the time to streamline what is happening. It is an unfortunate situation that even right now, the Kenya psychologists are not appreciated on what we do. The task force that she's mentioning, our chairman, our national chairman, Dr. Oscar Githua, was part of the task force, which was a good thing. And we really look forward to when the recommendations of the task force will be actualized. But I want to ask the government that this is not the time to start joking with the mental health of our people. Yeah. We can look at other issues. It seems like the government is really prioritizing on the wrong things at the wrong time. Because in times of pandemic, we should be taking care of the mental health, because our mental health is our mental wealth. If we are not healthy, where will the government even get its taxes, where it's going to run its own businesses? Yeah. Peradventure, we lose so many people. Or we get so many people in hospitals. Our doctors are going to be overwhelmed with issues that we could have prevented. Yeah. There is one thing that not so many people are discussing about it, but the issue that our children right now have closed school. Last year I took a better part of my year, later in the year when the schools reopened from September, and in the better part of this year, I can tell you the teachers are really struggling with children who are having first withdrawal symptoms, because some went into drugs. Some children even went into depression last year. Their parents lost their jobs. The children went into mistreatment because of their guardians' lack of mental well-being. And so these children now took those challenges to the teachers. And when you look at this, it looks like a vicious cycle where everybody is affected. And so my request to the government is, kindly, can we fast track this? Because when you hear a senator saying, in the next 1 year, where are we going to be next year in April? We are going to be in an election mood. Have we really wasted 5 years where we could have streamlined mental health into the government? Yeah.
Let me bring in Major Mukuria on this. Major, before you joined in, we were talking about the gaps that we're sort of seeing when it comes to dealing with mental health. From your perspective, what is missing here?
What is missing is the presence of mind to connect our posterity with our mental health.
Yes, kindly explain.
What I mean is, we are basically a collection of how we think, how we feel, and how we behave. You know, at the end of the day, whatever it is that we are seeing out here in form of behavior is strictly rooted on where people are psychologically. So if we are going to have people who are suffering from long-term anxiety or depression, intergenerational trauma, we are going to have a very upset and chaotic society where virtues of nurturing, care, and really just advancement and the progression of our humanity is literally going to be stalled. And in place of it, we open up ourselves to the possibility of living this life where the person with the most resources to have a good, or rather a balanced mental health status is the one who is going to be able to enjoy the good life. And the truth of the matter is that we cannot be able to exist in isolation. Yeah. Whatever is happening to the person who has the least is going to affect the person who has the most, and everybody else in between. And therefore, to see everybody be at a place where they can manage their grief, be at a place where people can manage their sadness, people can manage their disappointment, their shock, their trauma. This is really a time to collectively understand that we're going through a human process, and it's not a thing for some people to suffer and some others not to suffer. But that is what we have going on. So a lot of people are going to be left behind.
Major, Major, can we directly relate the accelerated depression to our economic situation? Because we're seeing a situation where even the friends who used to be able to support you themselves are going through a tough time. And then comes the grief issue coming in, and then comes cabin fever. Can we directly relate this economic pressure to the increased levels of depression?
I would say so, only because we identify so much with what we can give or what we can be able to take to make us comfortable. There's a lot of investment in, outside physical comforts. And we are also not a people who have trained ourselves to be readily adaptable. I think at the end of the day, we have for a very long time just been about acquiring more and more. And the loss of things has really affected people's ability, number one, to even have a sense of identity. Who am I without a job? Who am I without that house? Who am I without that car? Who am I without that holiday? And really made people stick to that, because I think we also have this thing where, depending on who you are, that's where your social capital is. And it's basically a very monetized function. So in as much as we understand what is bringing about this depression, I think it's possible to see it as an opportunity to redefine our identity. But I guess people have to have that emotional, mental, and cognitive bandwidth to be able to do that. And this is where I think the support from the national government comes, because a lot of people don't know how to do this themselves. How can they be assistants? And I think that conversation now connects with what Senator Kasanga and Ken Munywa are saying, where it's the support from a national level to help people with something they have not had to deal with before in a very extraordinary time.
All right. Honorable Kasanga, what are the highlights of the bill? In as much as now it's starting the cycle again, how do you think it was going to resolve the issues we're facing today?
Trevor, this bill creates a very wonderful framework on how to deal with the issues that we are seeing in this country today. First and foremost, it's good to understand that we are amending a bill that is an 1989 bill, outdated, does not even align to the Constitution and all that. So first and foremost, it's bringing up mental health issues to the current status, current dispensation of our Constitution. And the first aspect of the bill, of course, is to obligate each level of government to address issues of accessibility of mental health care, treatment, and rehabilitation. And those are very critical issues, both at national and at county level. And because, health is a devolved function largely, so a lot of burden is placed on the counties when it comes to rolling out whatever policies or whatever issues that the bill brings out. One other very critical thing the bill brings out is, aligning it to the Convention of Rights of Persons with Disabilities, because Kenya has ratified this convention, and therefore anything with issues of illness must be aligned to this convention. So this bill actually goes and builds largely into that, human rights issues and the rights of somebody suffering from mental illness, issues of their properties have to be all canvassed in there, and helping somebody who's severely ill in making decisions and choosing their supporters and administrators and all that stuff is actually encompassed in this bill. It's a very broad bill, and it's a very thoroughly thought through bill. Of course, with the help of like Major Mukira there, she was very passionate when it came to matters of our men in uniform, both in the defense forces and in the police, and she was very passionate. I remember bringing out all the submissions, which were all captured in the bill. And the psychologists, of course, they all participated in this process. The bill also has a multi-sectoral approach to how we should deal with mental health because of the aspect of stigma and education. So it is looking into tasking, like the Ministry of Education to look into the curriculum of early childhood education, It is also looking into issues of the welfare of employees, so tasking employment places to make sure they have, the requisite support, psychosocial support. And the same goes also to all other institutions, including government institutions, to offer psychosocial support to their, to their workers. And then the bill, of course, goes into other matters of operationalization, where we are looking into the membership of the board, the mental health board, and realigning it, with the current dispensation, and ensuring that the board has enough representation across board of matters of mental health in the country. Yeah. And the same of that operationalization is seen in the county government level as well, where they're supposed to have also county boards on mental health to ensure that policies are rolled out.
Yeah.
But very largely, the bill obligates the county governments to provide community-based care and treatment of mentally ill persons. And this is very critical because the modern approach towards mental health treatment, rehabilitation, and care is community-based. And therefore, this bill has gone to the, to the tried and tested modern way of dealing with mental health, which is not institutionalization, but more an approach of home. And that's why we are saying our battalion of mental health practitioners, that is the psychologists, and the community-based healthcare workers now need to be completely activated at the county level governments, because we have to reach people right to their homes.
Okay.
In fact, Trevor, when you remember our conversations at the ad hoc committee, when the Interior Ministry activated the Nyumba Kumi initiative, we were happy because Nyumba Kumi initiative also works to support what we are talking about here today, because you're looking out for your neighbor. And if you notice distress in your neighbor's home, then something can be done. You can call out to the, to the chief or the sub-chief, and you get them to come and rescue somebody who's mentally unwell. In fact, if you remember last year, there was a very unfortunate case of a mentally ill lady who was walking around somewhere in Valley Arcade. And people would take videos of her rather than helping her. And we had to really call out this issue, and task the Ministry of Health on what they can do. In fact, I personally spoke to the Ministry of Health, and they assured me that our chiefs and sub-chiefs within the cities are equipped to handle such cases, and all that is required is for Kenyans, to have that compassion and reach out, make a phone call, and they will be rescued, and there are mechanisms of that kind of rescue and help. Yeah. So these are the things we are talking about: a community-based approach to treatment and rehabilitation and care of mental health is very critical, and that is what this bill really, really pushes for.
Yeah.
Also critical, which I must mention here, is the alignment of mental health to the general health care, or integration, so that we don't encourage building of mental health institutions, which then propagate the stigma and make the stigma even worse. I mean, Mathare is a very important institution in this country and in the region, being the referral hospital for mental health, being the training facility and research facility. But there's so much stigma attached to it for many other reasons, which we need to really break down and tell Kenyans, actually, Mathare is the place you're going to find, the best, care, the best advice, the best intervention. And therefore, we break down having these institutions and instead have all our practitioners in each and every level of hospital, right from level 2, if possible, even level 1. Okay. So that Kenyans, when you go to get, general checkup, even if you get your practitioner there to check on your mental wellness, or you can get, some interventions or some education or some information to do with your mental wellness. So that integration is very critical, because it also includes the financial aspect of access, because NHIF now can cover everything inclusive, because mental health is expensive to treat, especially. It's very expensive to treat. And it is important that NHIF, as we roll out the universal healthcare system, it covers all Kenyans for mental health issues. And this is something we've been very passionate about, and we've been pushing. And I know the NHIF is fully alive to this fact, even as they work on their restructuring and whatever they're doing. Mental health is a key component to what they are supposed to cover and to what level they are supposed to cover. So those are some of the highlights, but there's really a lot more to this bill.
We'll delve into that in just a bit. But Major, let me bring you back into this. And Major, you've been a woman in uniform, and you know what they've gone through, you've been in the trenches as well. Should we treat our men and women in uniform differently, especially when it comes to issues to do with relationships? Because sometimes they are armed, and we've seen situations where people decide to just use their firearms. Should they be treated differently? And what is the best approach?
When you say differently, Trevor, what do you mean? Treat them differently in terms of?
In terms of the procedure, even the approach to their mental health and their mental well-being. Should it be like every other person, or should we have categories?
Well, my view is that men and women in uniform are really a very special category and population of this country. And that is why it has really become my life's work to be able to bring that focus on the very unique working situation that men and women find themselves in that are totally unrelatable to the rest of the population. So in as much as there is a standard way you can be able to address certain things, we just are a very special kind of people who require a very tailor-made approach to be able to bring wellness, to be able to guarantee treatment, management, recovery, and rehabilitation. So yes, they do need to be treated differently because maybe unlike everybody else, when it comes to them or us, it is a matter of national security, as it has become rather obvious through time. So yes, there should be special attention that is given to the wellness of men and women in uniform, their families as well.
Yeah. Do you see some, Major, do you see some level of cognitive dissonance there, especially in the men and women in uniform, because you are taught to be tough? So that vulnerability doesn't apply to people like yourself. And would you relate to a normal psychologist like Ken, or should it be someone like you who then understands where they're coming from?
It definitely would have to be somebody like me. And I say that because I've been through this journey where I remember having a supervisor, a psychologist for my clinical supervision, and I would talk to them and they would be like, no, that's not possible. There's no way, you know. So definitely there's a lot to do in terms of even, maybe even having more exposure for other psychologists to be able to understand the world of men and women in uniform. But I can assure you it's not civilian mainstream. That I can guarantee that is not the case at all. And, you know, here we are not talking about, you know, every time people hear mental health, what registers is mental illness, right? But what we are talking about here is to be able to factor in your mental state as a holistic part of your health, right? And so you cannot be able to say that I am willing to treat your broken limb that you got because you are drinking and completely ignore the fact that, for example, somebody is an alcoholic, is chemically dependent and stuff like that. So there has to be that holistic understanding of health as something that incorporates 100% wellness of an individual. But of course, when it comes to men and women in uniform, it's a special population because even the things that happen to be able to make somebody a soldier have a lot to do with changing the emotional, cognitive, and even physical makeup that the person initially had. And then we think this situation of isolation where we're not able to relate with the civilian world, if I may call it that, and the realities have to do with that. But there is also a lot of shaming, and this is not just in Kenya, but it's a universal principle where you cannot be seen to be vulnerable. It's translated to weakness, and nobody wants to be seen like that. So how can we be able to draw a line between somebody who needs help and somebody who is simply being stalked? And I think it needs kind of an understanding of the makeup of that work to be able to know that these are the kind of people who present in this fashion will require help, and this is the kind of help that is be able to bring them back. But also that inability to relate differently from what is termed as what is work-related and what is family.
Yeah.
Is usually very fluid. There is no separation. It's not like when a soldier just goes home or can be able to go a country. You know, a soldier's life being a lot of time away from family, work-related environment, but even that family being encompassed within the work environment where this person lives. So there is no separation of the social factors that make us up as human beings. So it's difficult to relate in a way that is not work-related. I don't know if that makes sense.
Yeah. I believe it does, though we are civilians, but I think it makes sense. So we're back in just a bit. I'm taking a quick break here on Daybreak. When we come back, we talk about what has been done so far, and let's start with you, Ken, and also find out how do we deal with these issues that we're seeing now. There's a bit of cabin fever, there's a bit of loneliness, that's coexisting with several different generations in a family, where you're used to having them in school, now they're with you, you don't understand what they're saying, sometimes you don't even understand their language, and you have your own issues as well. How do you deal with that? We'll be back in just a bit. Keep your views coming at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. I see some of them here. I'll be reading them in a bit.